All right, and welcome everyone to day 2 of the North Carolina Social Work Advocacy Week. And as I mentioned yesterday, if you joined us, on the second day of March, we recognize that it is Social Work Month. This month, we not only celebrate our amazing profession, but we also educate the public and our elected leaders that social workers are and always have been essential. Every day, social workers strengthen the well-being of those who are vulnerable and oppressed. And I would like to thank Governor Cooper, who has proclaimed March to be Social Work Month and recognizes the work that social workers have done to heal our nation during these turbulent and uncertain times. So during this session today, if you have any questions, be sure to put them in the Q&A. And if you're live on Facebook, make sure you type in any of your questions that you may have for our panelists. And I'm pleased to introduce all 3 of the social workers who serve on the North Carolina Andrea Harris Social, Economic, Environmental, and Health Equity Task Force. Governor Cooper signed Executive Order 143 in June of 2020 to establish this task force to address the social, environmental, economic, and health disparities in communities of color disproportionately impacted by COVID-19 in North Carolina. Who knows more about these issues and how to address them than social workers? We are honored to welcome the 3 social workers who were appointed to the task force by Governor Cooper. We have Yazmin Garcia Rico, who is the new Director of Latinx and Hispanic Policy and Strategy at the North Carolina Department of Health and Human Services. We have Quinny Sanchez Lopez, who is the Community Impact Manager at Unite Us. And we also have Dr. Sonyia Richardson, who is Assistant Professor at UNC Charlotte School of Social Work and owner of Another Level Counseling and Consultation in Charlotte, North Carolina, and the 2021 NASW North Carolina Social Worker of the Year. So I would like to welcome you all and first invite you to introduce yourselves and tell us a little bit about how you became a social worker, what kind of social work you do, and how you were appointed to the task force. So let's start with Yazmin. Would you like to start and give us a little bit of information about yourself?
Of course, thank you. Thank you so much for having me. I've been looking forward to this day. I remember attending Social Work Advocacy Day years ago as a student, and it's excited to be on this side, sharing a little bit about my experience. I am Yazmin, grew up in Mexico and came to the US in 2002. Have been in North Carolina ever since, grew up in Alamance County here in North Carolina. And my life experience is what really led me to social work. I attended Guilford College in Greensboro as an undocumented student, and I was undocumented for 10 years. And that path is what really got me close to the issues that our Latino community faces in North Carolina. And that really motivated me to push for change around different issue areas, access to higher education for Latinx students in the state, advocacy around farm workers. And there was a time where I remember looking around and all the people that I looked up to, all of them were women. They were all social workers. And that's when I decided to go back to school and pursue a Master's of Social Work at UNC. So that is what led me to become a social worker, have always been involved in social justice issues. And I love that our profession has that in the code of ethics. And I forgot what else the question was.
Sure, so just a little bit about what you're doing now.
Thank you. I have 5 months as as the new director of Latinx policy and strategy at the Department of Health and Human Services here in North Carolina. It is a humbling experience for me to be the first one to hold this position, especially in a time of so much need in our state. We know that the Latino community has been disproportionately impacted by COVID-19, and that there is a lot of work that needs to be done to make sure that we provide the resources that the community needs to be able to recover. Right now, we're working on vaccination and making sure that we support the community. So I have 5 months, 5 weeks into the job, learning a lot, what it means to be a state employee, and bringing all my experience personal and professional into the job to make sure that we are thinking about the needs of the community and addressing those in the solutions that we're proposing and the strategies in the state.
Thank you so much. Quinny, can we hear from you a little bit about how you became a social worker, what you're doing now, and your role on the task force?
Hi, everyone. My name is Quinny. I also, like Yazmin, was born in Mexico. I came to the States when I was really young, Carolina when I was 8. And so I really consider myself a North Carolinian because most of like my formative years as an adult have been here. But yeah, I became a social worker more of like on a non-traditional path. I was actually pursuing ministry in college, and through like my connection like with my church and like my faith, I really realized like just like the importance of having like people of faith like approach spaces of community outreach or even social work with more of a knowledge base around what it means like to do social work, or just like a justice focused lens. So I did a few jobs doing community outreach out of college, and those really kind of just allowed me to not only learn but really experience what it was like to be in a community that was affected by wealth and racial disparities. A lot of the people that I worked with were Black and or immigrant, and a lot of the immigrant families were undocumented. And so just seeing like the limitations that I had with the community outreach program that I had to make more system level changes really was kind of like the thing that really like pushed me to like hit apply on my application. I really wanted to make more of that bigger level impact. And currently I work for Unite Us. So Unite Us is a tech company that addresses health inequities and health disparities. We're currently actually working with the Department of Health and Human Services to create a platform. It's been created. It's called NC Care 360, and it's a coordinated care tool that connects different providers across the state. And when I say providers, I mean medical services, clinicians, nonprofits, churches, like really it's like any organization that is serving people in one way or supporting people. We seek to connect them so that people aren't lost on this chain of seeking to get services. And it's a newer organization. It's only been around for about 3 years. So really having the opportunity to step into a new organization and use my social work expertise to kind of like say like, this might not work in this community, or maybe let's think about this. I'm glad to like be a social work voice in a space like that. And on the Andrea Harris task force, I am on the education subcommittee. So education is academic, financial literacy, and health literacy. And I am one of the members on that subcommittee.
Excellent. Thank you so much, Quinny. And how about you, Dr. Richardson?
Hi, well, welcome everyone to the webinar. I'm definitely glad to be here. I'm glad to be part of the task force. So my path is maybe a little different. So in undergraduate, I was majoring in psychology because I knew I wanted to work with people. And it was my psychology professors who encouraged me to go for my master's in social work because I hadn't technically heard of social work as a field at the time. And the other contributing factor was my grandmother worked with juveniles. And she also was involved with individuals living with sickle cell disease and advocating for that population. And so I received my undergraduate in psychology. I listened to my mentors, and I say that to people out there now. Your mentors have access to lots of great information. Listen to their wisdom and advice, and I did. And I went on to get my master's in social work from UNC Chapel Hill, early 2000, and 2001 actually. And then after that, I worked for a couple of years. And one thing, as far as my progression through the field, I knew coming out of school that I could get a job and work for people, but I never knew entrepreneurship was an option for me. And so it was not until I was a director of counseling at Johnson C. Smith University, there was a speaker that came in and spoke to social work students, and he was an entrepreneur. And he talked about how entrepreneurship is an option for us as social workers. And it allows us access to different types of freedoms, additional income, revenue, et cetera. And it allows us to pursue our purpose. And so a couple of years after that, I ended up starting an agency, Another Level Counseling and Consultation, which is in Charlotte, North Carolina. It's a behavioral healthcare agency. And we've been established and operating for 14 years now. And so I'm excited about that because most small businesses don't exist past year 1, year 2. And so I've had that agency. And in providing services at the agency, currently our population is about 85% people of color. So we primarily serve people of color, and our practitioners are all also people of color. And so it's been interesting really being able to focus in on that area. In addition to that, a couple of years ago, there was an opportunity for me to teach. My mom is an educator. She's been an educator for 30 plus years. So teaching is in our genes. And so years ago, I started teaching part-time at UNC Charlotte. I ended up coming on full-time a couple of years after that. And then within the last year or so, I wanted to be able to contribute to research. And so I completed a Ph.D. It's not in social work, it is in urban education, curriculum and instruction. And so it gives me access to now understanding the education field in addition to the social work field. And so I currently am an assistant professor at UNC Charlotte in the School of Social Work. And I still own and operate a mental health agency, and I'm a researcher researching Black mental health. And so those are my lanes, and those are lanes that I attempt to try to stay in. And so I say all of that to say there are so many options in our field. There are so many things that we can do. We don't have to be restricted to these positions that don't allow us to operate in our purpose. And so I just encourage you all to dream bigger and to do what it is that you've been called to do and what you feel like your purpose in life is to do. As far as the task force, I'm honored to be a part of the task force, and it happened for me through my membership with NASW. So I've been a member of NASW for some years, and I served on the board several years ago. I continue to serve on the board as a delegate, and it's through the relationship with NASW that my name was recommended along with other social workers to Senator Sidney Batch, who at the time was a representative. And she was able to put forth those names to the governor, and then the governor selected me to serve on the task force. And so I say that to say, it's your membership, participation, and involvement with organizations like this that will give you access to the table and allow you a seat at the table. And so I'm honored to serve with those Yazmin and Quinny on the task force, and we've had a great time together. And I'm also on the education subcommittee with Quinny, so we serve on that together.
Excellent. Thank you so much, Sonyia. So now I am hoping we can go into a little bit more about the task force. And Sonyia, I think you were going to help us and the audience understand a little bit about your work. We've heard a little bit about the subcommittees, but you also made some recommendations. So I'm hoping that you can talk a little bit about that.
Absolutely. So I'm going to refer to it as the task force because it's a very long name, but the official name is the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force. As Valerie stated, this was established by Governor Roy Cooper through Executive Order 131, and it was a result of the disparities that were occurring in the midst of COVID-19. So we all know in the midst of us all dealing with and continuing to deal with the COVID pandemic, what's also been illuminated through this pandemic is the health disparities, health, economic, and social and environmental disparities that exist. And so this was an opportunity for the governor to put forth an order and bring together leaders from across the state to address these issues intentionally in our state of North Carolina. So just to give you background on the task force, it is named after Andrea Harris. So since we are leaving Black History Month in February, entering into Women's Month in March, and celebrating the work of social workers, I wanted to bring up Andrea Harris' name because it is named after her. Andrea Harris was an African-American civil rights activist in our state of North Carolina who dedicated her life to eliminating disparities in North Carolina. And she fought for both social, economic, and racial equity for all North Carolinians and left an impression on the state of North Carolina. So if you don't know her name is Andrea Harris. And Governor Roy Cooper described Harris as a trailblazer who never stopped fighting for social and racial equity. So Harris was not a social worker, but she was committed, as we are, to social justice and racial equity. And she also opened many doors for women of color and women throughout the state of North Carolina. So the task force is comprised of approximately 33 members. The three of us are members. We also have membership from some really distinguished leaders in the state of North Carolina. So some of the examples of other members of this committee include Jean Woods, who is the CEO and president of Atrium Health. You have Reverend Dr. T. Anthony Spearman, who is the president of the North Carolina NAACP. We have Greg Richardson, who's the executive director of the North Carolina Commission of Indian Affairs. And the list goes on and on. So these are people within the state who are positioned to be able to make decisions, to have an influence and an impact. And so within so we have a task force of about 33 members. We meet twice a month. Once a month is a public meeting. Well, all the meetings are public, but once a month is a meeting for the entire task force. Anyone can attend. So if you go to the website, you can sign up to get access to attend these meetings. And then it'll allow you to be in the space and to listen to the content and what's discussed. So we have those meetings. And then we also have subcommittee meetings. So the task force is comprised of 5 subcommittees, as well as a business engagement group. And just to give you information about the subcommittees, we have an Access to Healthcare Committee, an Economic Opportunity and Business Development Committee, Educational Opportunity, Environmental Justice and Inclusion, and then Patient Engagement. So those are the 5 areas that we're focused on. Within each committee, you have about 5 to 6 members on each committee. We meet once a month as well or more, and we begin to really strategize on our area. So Quinny and I are in the Educational Opportunity Subcommittee. So we are working on goals specifically for that. I think Kay had put into the chat a link to the website. If you go on the website, we have a biannual report. So we convened last year, mid-year, and we ended up publishing a biannual report in December. And I would encourage you to go and look at the report. It tells you the goals and objectives of each subcommittee and what our recommendations are. Now, we put our recommendations forward in this report, and this report then is shared with the governor's office. So it positions us to be able to have some influence with decisions that are made in our state. Some of the main recommendations that we came up with in December of 2020 included recommendations to encourage ongoing telemedicine and telehealth services, Medicaid expansion, medical school pipelines, particularly for people of color, and digital literacy, and then job initiatives. Those are just some of the areas, but I would encourage you to go and read it when you get a chance, because they really do align with our work as social workers. We also have, lastly, a one-page policy recommendation. So just like NASW has their policy or legislative priorities, we have our priorities as well. And it's called a one-page recommendation, but it's 2 pages. But if you go to our website, you can see those recommendations on there as well. And then lastly, I would just encourage you, all of you, you can view, I think, past recordings, you can attend our meetings, you can participate even if you're not on the task force.
Excellent. Thank you so much, Dr. Richardson. So I would love to bring everybody back, Quinny and Yazmin, and ask you a few questions about your role on the task force. So you talked a little bit about the work that you all are doing on these subcommittees, and based on what Dr. Richardson just talked about, This is all very relevant to the social work profession, all areas of practice in which you work. And so I'm really excited about the voice that you bring from your social work perspective onto the task force. Can you talk a little bit more, Yazmin or Quinny, about your role on those subcommittees and why it's critical for your social work voice to be present? So Dr. Richardson talked about some other distinguished individuals, but you as a distinguished social worker, the importance of your voice on the task force and within your subcommittee.
Of course, I can go ahead and get started and let Quinny join. For me, when I came into the task force, I was working as a program manager of the Healthy Communities Department at Alamance Regional Medical Center, which is part of the Cone Health system. I was working there. I worked there for about 3 years. And over the last year of the pandemic, I was doing a lot of the COVID-19 rapid response needed in the county, supporting a lot of community-based organizations, supporting a lot of the Latinx community and African-American community, and coordinating the mobile units that were bringing the testing out from the health institutions to the community, meeting them where they are, which is a key point of us social workers, of understanding that we need to go where the community is, where they feel comfortable, and not expect them to, to come for resources. So I think for me, that work elevated my contribution in the community as a social worker, and as someone who was working in public health areas. And someone recommended me, and I ended up accepting to be part of the task force. That I feel that was key in the patient engagement committee, which I'm part of. My work on the ground, doing, from setting up the tents to figuring out how we get internet. Those things might seem like not important, but when you're trying to figure out a strategy at the state level and communities are in the same place, trying to figure out how you do the testing, how do you gather the data that is important, the demographic information that we need to know how COVID-19 is affecting communities, who's getting affected the most. I feel like I was able to bring that perspective from my work, and also as a social worker, and understanding the community that we were trying to reach. We had a lot of conversations around how we make sure that testing and anything that we do is not intimidating to the community. We had long conversations around police presence at testing sites and how that was not a good idea if we really wanted to build trust with communities of color. From language access to how we promote the event, who we partner with. I think all those key areas are things that we learn about in the School of Social Work as we are doing different internships. You learn that collaboration is key and is crucial, and working alongside those who already have the trust of the community so that we can go farther in a little bit, faster way. So those were some of the conversations that we had. My experience working with the Latinx community was key. Because as we are building strategies, we cannot think that all, one strategy is going to work for all communities of color. Oftentimes we're put in a box, and people think, if we do this one thing, it's going to reach everyone. But we really have to make sure we remember that communities are diverse, even within communities. Even in the Latino community, you have people who were born here, who feel more comfortable in English, people that are recent immigrants or are 20 years here, but still feel comfortable in the language that they speak. And so having information and resources, it is important. So I felt at the beginning a little intimidated, to be honest, because I was, doing county level work, and I didn't understand at that point the importance of my voice. But being part of those conversations and understanding that I had a lens that no one else had. And if I didn't say what I was thinking, no one else would, that really encouraged me and made me feel that I was where I needed to be at that moment, to be able to speak about the things that I was seeing in my experience, and make sure that the policies that we are proposing are having a direct impact on the communities that are being affected the most.
Yazmin, that was great. I really appreciated you making the comment of I didn't know what I had to bring to the table, essentially, because I felt the same way too. I graduated May 2020 with my master's degree. So I was fresh out of grad school. I was working as a contact tracer. And so when I was nominated, I felt like, why me? But like now that I'm on the task force, like it's been a few months since August when we joined, I can see also why I was nominated. I think social work education in general gives us a perspective of the way that things happen. Like people don't choose to be poor, they don't choose to be homeless. Like these are not choices. And I think we have the opportunity to speak up about that with a context of like, this is how that happens. And I think also as a younger social worker, social work education is changing and it's changing fast. I think I was just reading an article on the UNC website and how like race is being talked about more now in the school and how they're applying critical race theory in the social school of social work curriculum. And I love that. And it's like, I think just having more like of a fresh understanding of some of those concepts. I think I was really intimidated to kind of like, I don't want to say like push back on tradition, but I do think a lot of the ways that like things are, especially like in government structures, are very traditional. And I think having someone that is younger that might not be used to that or is more likely to ask, why are we doing that, is really important to bring into these spaces. So I think sometimes we discredit our lack of experience and we call it like, I'm not equipped, when rather it's like, I want to understand where this is going. And because as a social worker, that's what we're trained to do, I think it brings a lot of value into these spaces.
Thank you so much, Quinny. Anything that you have to add, Dr. Richardson?
No, I'll just add that it's interesting serving on the task force because even after having about 20 years of experience, I was still in the same boat of questioning, okay, how did I end up on this task force? And so even with the years of experience, still felt the same thing. But I will say in serving very closely with Quinny shows up like a 20-year-old, a veteran social worker. Like and I'm so proud of being able to serve with her in the education subcommittee. And so I think it's for me, it's been important to make sure that that people are aware that I'm a social worker, number one, that I'm an advocate, number two, that I'm committed to social justice, and that I will be that voice that will bring up some of the same issues over and over again until there's some type of resolve or solution. And so oftentimes in the meetings, some of the topics that, I make sure that I'm bringing up are supporting Black-owned businesses, supporting women-owned businesses, mental health, making sure we're prioritizing the mental health needs of our community and supporting those providers of color as they progress through the system, as well as our communities of color. And so just making sure that I'm consistent about the issues that I speak about, but at the end of the day, the task force members know that I'm a social worker. That's been key and been very important.
That's excellent. Thank you so much, Dr. Richardson. So last week when we all met to talk about meeting today, you all mentioned how much you've enjoyed serving on the task force, but this was just a different space and how much you've had to learn to navigate this space and really learn how to elevate your social work voice, which you touched on a little bit. So I'm wondering if you all could talk a little bit about how you had to learn how to navigate this very different space and use that social work voice in order to articulate the importance of the issues that you were talking about.
I guess I can jump in first. It was a learning experience prior to being a hospital employee, I was working in nonprofits for many, many years. And the vibe in nonprofits was different. It was more like we're all in the same level, we're all colleagues, we're all, you know, working on this together. Then I went to Cone Health and learned more about the corporate feeling of spaces. And then took it the next level was being part of the task force and learning about the different guidelines and the different processes. So it definitely was a learning experience for me, trying to figure out who else is in the task force that I could talk to, talking to my supervisor, who is a social worker as well, trying to process things with her, figuring out, you know, what are some solutions. I feel like as Dr. Richardson mentioned, there is a lot of power in that space, and figuring out strategically what can be accomplished, who can we talk to, what can we actually do to make change at the system level, policy level. So I would say that kind of reflection and conversation with other people is crucial to be able to understand the space, the place, the people, you know, understand the state, how things are different, because everyone is coming to the same place with a different lens and trying to figure out how do we do something that will be able to have an impact in everyone in the state and specific communities as well. So I would say that, you know, having those conversations, looking for your social worker fellows that can talk to you and support each other. I wish I was in the same committee with Dr. Richardson and Quinny. That would be, you know, an added support system. But I think just finding those people that you can talk to for me was very important.
Dr. Richardson and I were going to go at the same time. But yeah, I also reached out to a professor at the School of Social Work who is also on several task forces. And I asked her the same thing, like, I'm new in this space. I don't know what I'm doing, essentially. And I think she kind of helped me like realize like also the complexities that it is to come into a task force when it's all digital as well. I think in a traditional space, there you would be coming into a room and people who knew each other would sit near each other. And on this like digital platform, it's like we're all kind of just scattered about. And so I think it in some ways it leveled the playing field of like I'm building relationships with a lot of people who are here new too. I think also like I spent a lot of like the first few meetings just observing and kind of learning like what is it that we're doing. So just coming with like a perspective of learning, I think is also very valuable. When actually working in the committee, like our small groups is where I feel like most comfortable talking. If we're like in a large committee meeting, like with all of our members, I'll use the chat feature a lot. And that's brought up some really great conversations just with asking questions. And in our smaller subcommittee, I'm able to like have those more robust discussions or raise questions that our committee can kind of develop solutions to. I really love having Dr. Richardson in my subcommittee. We've been able to branch off and work on like we did like some of the policy recommendations as a team. And it was just so clear that we were both social workers because our minds automatically went to like, who are the marginalized groups? Like, who are the people that are getting like sidelined? And I think that's like the perspective that we bring, like whenever we're in these spaces. It's just like more profound when we're with each other. It's like we're reading each other's minds.
I would definitely agree with everything that has been said. I think serving on the task force required preparation from each of us. And so my preparation included speaking to someone at the university at UNC Charlotte about serving on a task force and what that was like. I also reached out to Kay. I had a one-on-one session with Kay to kind of understand the structure of task force, how it works, how to be successful, maybe some initiatives that NASW is supporting and how I could lean that voice into that space. And so I reached out as well to people who I knew could provide me some direction. I also spoke to someone who's on the Board of Education for the state and kind of learned how to bring my platform into a space. And I say platform, and what I mean by that is like the issues that I'm really concerned about, particularly as it pertains to diverse communities. And so just learned how to prepare for the space. And then as Quinny said, showed up in the space, just as like Quinny said, I didn't talk for a while on the task force. I used the chat feature because I could get my thoughts together and I could say things. And in this space, in the task force space, there's a lot of formalities. It kind of takes me back to my experience at a HBCU. When on campus, we went by titles. So I was never, at the time, Sonyia Richardson. I was never Sonyia. I was Mrs. Richardson. And you use very formal titles with everyone. This space has very formal titles. So we're having to say Secretary Saunders or Deputy Secretary Ben Money. You know, we're having to use these very formal titles that we don't use those on a regular basis. And so I've taken some time to learn and understand how to show up in these spaces. And I'm just now getting more comfortable really talking more in the sessions. I'm very comfortable, as Quinny said, with the subcommittees, but it took some time for me to learn how to navigate these spaces and how to fully show up in participating actively and talking actively during the sessions and meetings.
Thank you all so much. So let's talk a little bit about how you would encourage, and the question that I had was new social workers, but I think all social workers to get involved in this and other types of advocacy at the state, local, or university level. So not everyone will have the opportunity to be appointed by the governor to a task force. But in the work that you've done, can you talk a little bit about how other social workers may be able to get engaged in advocacy, as it is in our code of ethics to be engaged in social justice issues? And a shout out to part of the code of ethics standard 6.04, social workers should engage in social and political action that seeks to ensure that all people have equal access to resources, etc. So talk a little bit about any advice that you might have to new and seasoned social workers to get engaged in this kind of work.
I can start. Sorry, Yazmin.
Go ahead.
Yeah, so even though I'd never been on like a statewide or even local subcommittee or task force, I have been involved in things like committees through the School of Social Work. So I think that's something that a lot of us can understand. I think sometimes there are things happening at the School of Social Work that we want to be more involved in. And there are usually subcommittees. I know at least at UNC, we have a curriculum subcommittee or a macro or direct practice subcommittees. And so you'll have professors, deans, administrators, and students come together, and they'll have the opportunity to kind of discuss like, what are the things that they're working on to improve things at the School of Social Work. And so I was able to be a part of the macro committee at the School of Social Work, and through that gave input on our curriculum and was able to be on like committees where we did studies or did outreach and cast surveys and focus groups with people who have graduated or were currently at the school. And I think that gave me more of like it gave me the experience to be able to enter a space like this, knowing I've done something like this before, like my voice mattered, and I have thoughts that I can contribute to this. And so even though I was learning there, it was something more relevant to like my context, and I felt more comfortable, which allowed me to do that in this space. I've also I worked with the Orange County government in the housing department. And there I was like helping coordinate a task force on housing for the county. And I saw that there were several students from UNC. There were some that were in grad school and some that were in the undergrad. And I think a lot of times we feel like we have to have like our career figured out. We have to like have graduated and have all of these accomplishments to be able to voice our opinions or be in these spaces. But like you can enter these. Some of these, like the one with Orange County, it was an application. Like you filled out an online application and they had a committee of people who reviewed them because it was a rotating membership. And so there are opportunities to get involved in the little microcosms that we're involved in, and opportunities to apply to be in places that like we might not have as much experience with.
I'll go ahead and go next. So I definitely agree with what Quinny said. And I remember the words, I hold on to the words of a mentor of mine who said that he used to get a piece of paper and put a dot on the piece of paper. And he would say, okay, this is where you see yourself here on this dot. He said, but really where I see you and where your potential is all the way over here on this other piece of paper on another dot. He said, so you have to awaken to your greatness. You have to awaken to who you are and all of your gifts. And so echoing what Quinny said, you don't have to wait until you have all of this experience, until you have worked for years and years in the field. Walk in your greatness now, show up in who you are now. So show fully up, whether you are an undergraduate student, graduate student, you've been in the profession for years, or you're just coming out of school, just fully show up as who you are in your space and give yourself permission to show up. I've had two students. One was, I think, undergrad at the time, and then became a master's level social work student. And while he was either an undergrad or master's level student, he applied to be a board member for NASW, and he is currently on the NASW board. But he was encouraged. You don't have to wait until you graduate to be involved in a leadership position with NASW. You don't have to wait to be involved with these committees. Be great now. Walk in your greatness now. And he did that, and he's been successful. And then there was another student, as an undergraduate student, she applied for a national social work board position. Now, granted, she did not receive that position. She didn't get the most votes, but she was so excited because she almost had 2,000 votes from across the country. And in talking to her, she was saying, you know, I don't even know how these people, like why they voted for me. I don't know 2,000 people across the country, but she took the initiative and believed enough in herself to do it. And so I would say to each person on the call today, be you, show up fully as yourself, take initiative and be great. Do those things that you think you might not be able to do except for 10 years later. Do them now. Like take the risk, take an option to do it now. And I think very clearly you've seen that from, you know, everyone that's on this call. We've all taken the risk and done things that maybe weren't comfortable for us, or we didn't know how to navigate these spaces, but we were willing to show up. And so I would just say, just show up and allow yourself to walk in all of your greatness.
I would echo what has been said already. I feel like there's plenty of ways and multiple ways that we as social workers can get involved in advocacy in all levels. Before the School of Social Work, I was already doing a lot of lobbying at the General Assembly. The first few times that I did that, it was intimidating. I was young. I was coming with a lot of youth and trying to speak about the importance of access to higher education. And it is intimidating because you don't see people that look like you in the building. So as a woman of color, as an immigrant, all those things are always, you know, with you if you have those identities, and navigating those spaces can be intimidating, but it is important, and especially even more important to try to aim for positions that would get us to a place where we can speak up and be able to push for change. So that is real. I feel like we all can do something every year, every day to do something that will improve the lives of the people that we're serving. As social workers in the School of Social Work, I remember there was Valentine's Day, and we did cards that we mail to our senators in Congress to push for immigration protections. And I think at that point we were something was happening at the border. Something is always happening, but that urgency brought us together to write cards with the theme of Valentine's and mail it to them. So you can do something every day, like a phone call. You can go in person whenever it's safe to do so. You can send a letter, and you can also get involved locally, which has a huge impact. And I feel like Quinny was speaking to that. There is a lot that can be done at the local level that many times we don't know of. We think either it has to happen at the General Assembly or in Congress in DC. And there is a lot of power at county level, government. An example of what we're going through right now, health departments have to respond, at the local level in terms of the public crisis. And a lot of times the decisions where the budget, the decisions of budget have to go through the county commissioners. So, working with your county commissioners, working with government officials at the local level can have a direct impact of the funding that goes to schools, that goes to health departments, and all the resources that we see in our community. So I know it can be overwhelming, because I remember being there where you see so many issues and you don't know how to, solve them all. You don't have to solve them all. Pick what you're passionate about and go with it. And if you work on something for some time, it doesn't mean that you have to do that, forever. I've worked on different issues, and the skills that you gain help you to keep moving forward the conversation in other spaces. A lot of the advocacy I did as a young student, I kind of realized, okay, I'm not young anymore, and let others do that, right? And share those skills and bring other people along so that they can also continue to push for change. Because the reality is that there's a lot of issues that it's gonna take a while. And there's people who have done a lot of work before us, and there's people who might need to do a lot of work after us. So continuing to move that work forward is very important.
Thank you all so much. So we've got a lot of great questions from the audience. So can you all talk a little bit about the recommendations from the task force? So what happens next? So you've made these recommendations, and they're recommendations to the governor. Then what happens next? So given the good question we have is, given the current political climate in the North Carolina General Assembly, as social workers, what other ways do you see as avenues to advance the recommendations and priorities of the task force? Very large question, I know.
I know. I can speak a little bit, and others can jump in. I think the work of the patient engagement committee right now, some of the policy recommendations that we did was to make sure that we're keeping up with the data demographics. And this was key, and this was important at the beginning of the pandemic. We didn't have the best numbers in terms of reporting of who was getting tested, of who was positive. All those things are really important. So I think some of the next steps are really taking that policy level, but also working with healthcare providers, working with everyone involved to really make sure that they understand the importance and to show them how they can feel more comfortable asking those questions. What is your race and ethnicity, and how to make sure that we're addressing that kind of added step into the workflows. So there's different people in my committee who are in healthcare already, who have connections, who have been having those conversations. So I think the point I want to make is policy is important, but we don't have to wait for policy to get approved for us to start doing the work. So that's kind of what I can mention as of now. One of the main recommendations of many subcommittees that we realize we all said it is expand Medicaid. And that is something that we can, propose, but it's not up to us per se to pass that. And so a lot of advocacy and also support from the broader community, from broader groups, to make sure that we are able to pass policy that will have that large impact.
I'll also add to that. I know with our subcommittee, we had a series of roundtables, and there were town halls for the whole subcommittee in general too, back in the fall. And this may not apply to our task force currently, because I don't know if any of the subcommittees have any town halls coming up, or open dialogues, but attending those I think is very valuable, especially as social workers. We see a lot of things. We hear our clients. We see how organizations are being run, in the sense of like sometimes they lack funding, or there's things going on in the community that are affecting the way that your organization can support the community. So I think it's really important to know when these opportunities are happening, so that you can be able to attend. And I think also it's really important to empower clients to participate in these kinds of conversations, because even though we hear from them and we witness their experiences, we're not the ones that are actually experiencing those themselves. And so I think it's really important also to empower people to like, this is happening in your neighborhood, like here's a town hall. Like, I think your voice would be really important in a space like this. So it might not be directly in our task force, but I definitely recommend that for things that are upcoming.
And I would agree to definitely get involved. And just to kind of give you more understanding, so we have the 5 subcommittees, and then we do most of our work within our subcommittees. And so within our subcommittees, we have 4 to 5 goals that we have prioritized for our work. And so what we're doing at a subcommittee level is taking those goals, we've prioritized those goals. So our first goal for the education subcommittee was to focus on digital literacy in the state of North Carolina, particularly for communities for which English is not the primary language. So we wanted to make sure the state had digital literacy tools for households for which English was not the primary language. So what we did next was then identify, okay, what's out there? And so we found out that the North Carolina Department of Cultural and Natural Resources has a digital literacy toolkit that they have been establishing for, I think, 2 years now. And so we recently had a meeting with them. And then in the meeting with them, we're talking about, well, has this tool been tailored for communities for which English is not the primary language? And it has not yet, but that gives us an opportunity to then use something that's already established to be able to advocate. And so I think part of what we're learning, or at least what I can say I'm learning in this process, is there's lots of great resources in North Carolina. There are projects that are ongoing that people have no idea about. But it's important for us to come together and figure out how to really collectively build these projects, make sure they're effective and equitable and meet the needs of the community. And so we are doing the work of the larger task force through the subcommittees. And then our subcommittees are then reporting back to the larger committee, and we're making progress that way.
Thank you all so much. We have had several comments and questions around how do you watch the task force? How do you get communication about the task force? So we put the website in the chat a couple of times. I'll also like to mention there is another task force, the governor's task force on equity in criminal justice, and that's led by Attorney General Josh Stein and Supreme Court Justice Anita Earls. All of that information is on the Attorney General's website, and they stream live on Facebook. So there are other task forces that individuals can watch. NASW North Carolina has made public comment to these task force, and that has been incorporated into some of the recommendations. But in addition to task forces, there are also boards and commissions at the state level, because a couple of folks were asking, well, how do I get on a task force? Task force don't come along every year. Governor Cooper had been in office for 4 years, and I think there'd been a couple of task force, but this really happened. Both of these came out during COVID. So whenever there are opportunities, NASW North Carolina does encourage our members to apply or make recommendations when these opportunities come. So we have a number of members on a number of boards and commissions for statewide commissions for the state. So if you all are interested, you can just go on the governor's boards and commissions website to see what vacancies there are, how to apply, and more information. Most of these, all of these boards and commission meetings are public. So it's great when social workers can attend these meetings and learn a little bit more about what's going on and how social workers' voice can elevate the work that's being done. So I'll stop talking. There are a lot of other great questions that we just weren't able to get to, but I want to offer any last remarks or thoughts from each of our panelists before we close out for the day.
I think I also want to add, I've been on the other end too of I've done a lot of community organizing as a volunteer. And I think sometimes going into a space like this, I can be really skeptical of the process. And so I think being in a space like this, I really had to kind of just learn what is the board that I am playing on, but also not discrediting all the experiences that I've had in the past. And so kind of Shane's question about how can we advocate even when those in government might try to make advocating impossible. I think this isn't the only way that we can advocate. Sometimes it does take being involved in a political campaign to get leaders into power that are going to make advocating easier or that are in favor of the things that we value as social workers.
I would add the importance of the social work profession and the importance of having representation from the community in professions such as social work. I'm always recruiting more Latinx students to pursue social work. I'm always connecting them with Sharon Thomas at the School of Social Work and telling them how amazing she was and how big of a support she was to me. More and more as I do work in the community where I was in Alamance County, realizing that there is not a lot of bilingual therapists out there, that there is a lot of lack of resources for the Latinx community. So encouraging people who are Latinx to pursue social work. If you know people who are Latinx that would be great social workers, bring them on board, because it is important to have that voice and support when you are, navigating different spaces. And I feel like that social work is what brought me to where I am right now, pursuing that degree and the preparation I got at the School of Social Work around policy. And now I'm working in a job that it's very macro. It's the macro dream job for me. So making sure that we continue to bring more people on board to follow this path and to help us make of North Carolina a better place for everyone.
And I would just add, we are always encouraged to contact our legislators. And I would say to also contact those who are serving on committees and task force. So Quinny and I had an opportunity to meet with someone from the Deaf and Hard of Hearing department at the state level. And they wanted to make sure that that voice was at the table for the task force. So if you're coming across, if you have a chance to look at the report and you come and you look at our policy recommendations and you have input or feedback that you want to make sure we consider bringing to the table, just reach out to us, send us an email. We are all accessible, and we want to advocate for those issues that are important for social workers throughout the state. So don't forget those people who aren't maybe legislators, but are in positions where they can still bring your voice and your population to the table.
Amazing. Quinny, Yazmin, Sonyia, thank you so much for joining us today. Thank you so much for your social work voice and being a part of our amazing profession. I would like to do a quick shout out for everybody to attend tomorrow. We have our last day of live events for Social Work Advocacy Week. Tomorrow at noon, same time, same place, we have Senator Sidney Batch, who is a social worker, Representative Greg Meyer, who is also a social worker, and Victor Armstrong, who is the director of the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, who will be with us tomorrow. And then also, if you haven't already, make sure you schedule your appointment. As Dr. Richardson said, reach out to those legislators. As we talked about yesterday with our panel of legislators, it is critical that legislators hear from you and understand what it is that social workers do within the communities in which you serve. So if you aren't successful in scheduling a meeting this week, please, we've got all long legislative session for you to reach out to your legislators. If you're feeling uncomfortable or having any issues scheduling those meetings with your legislators, feel free to reach out to NASW North Carolina. Thank you so much for joining us. I am Valerie Arndt. I am the Executive Director of NASW North Carolina. And I thank you so much for joining us today, and happy Social Work Month. And if you're not a member of NASW, please join us. We're working hard to advocate for the social work profession and the client populations in which you work with. So thank you so much, and we will see you tomorrow.